Good day, everyone, and welcome. I'm Jack Van Horn from the University of Virginia, and I'm very proud to welcome you to this edition of our 2022-2023 Foundations of Biomedical Data Science Seminar Series. The seminar series is supported by UVA's Integrated Translational Health Institute of Virginia, the UVA Brain Institute, the College of Arts and Sciences, the School of Data Science, and through grants from the National Institutes of General Medical Sciences. Since 2016, the Foundations of Biomedical Data Science Seminar Series has focused on the use of data science methodologies, artificial intelligence, deep learning, and statistical modeling as they pertain to differing themes in the biomedical and health sciences. This year's theme is data science and the public health consequences of the COVID-19 pandemic, where we will enjoy presentations on Friday afternoons from leading thinkers about the issues, the promise, opportunities, and hurdles associated with understanding the secondary health effects of the COVID-19 virus. These include delayed health checkups, treatments, mental health, drug abuse, policy implications, other things such as increased obesity and long lingering health effects associated with the COVID-19 virus. Participants selected for our Biomedical Data Science Innovation Lab will leverage these presentations as vital material for our culminating in-person grant project development workshop to be held at the Lodge at St. Edwards Park in Seattle, Washington in June 2023. Today, we have a very special presentation, and I'm delighted to welcome not one, but four speakers: Julia Roper, Autumn Lerner, Darcy Sawatsky, and Jennifer Cho from the Panorama Group based in Seattle, Washington. One of them, Julia Roper, is one of our BDSIL mentors this year. We're very excited to have her. And she is a senior program officer at Panorama Strategy, a social impact consultancy, where she works with clients ranging from biotech companies, philanthropies, and multilateral agencies to advance their health strategies, and especially pertaining to policy, program design, advocacy, and partnership. She's worked with the World Health Organization, UNICEF, and many other global programs, initiatives, and institutions. Autumn Lerner is a Pandemic Action Network Director of Communication and Partnerships, and she's an accomplished global communications leader, having over 20 years of experience at the intersection of social impact program leadership, cross-cultural management, integrated campaigns, and community engagement. And she has been involved in helping to deliver work across 30 different countries, and is extremely adept at building partnerships and managing stakeholders and influencing things across markets and various sectors. Darcy Sawatsky it was named a 2020 top woman in public relations by the PR News, and Darcy has a 23-year track record of success in health communications, public and private partnerships, social marketing, campaign development, and media relations. And as Vice President of Partnerships, Jennifer Cho leads Panorama's collaboration with philanthropists, philanthropic organizations, and strategic partners on a variety of diverse opportunities for impacting their work and the work of others. She has more than 20 years of experience in nonprofit development, working with a variety of different organizations and startup divisions from places such as New York University and various other organizations. In continuing with this year's 2022-2023 Biomedical Data Science Seminar Series theme, today's lecture from Team Panorama is After the Research, using policy, advocacy, and philanthropy as levers to address the consequences of COVID-19. The Panorama Group is a platform for social change. Their community of multiple organizations develop scalable solutions for some of the world's most pressing challenges. Today, the team from Panorama will speak about their work to alleviate secondary health effects of COVID-19 by mobilizing networks of partners, shaping policies, and advocating for resources and systems of change, and the role that data science plays in achieving those goals. As always, we are streaming this lecture live and for recording via YouTube. And if you're watching on YouTube, thank you so much for joining us. Also, our specially selected 2022-2023 Biomedical Data Science Innovation Lab participants and alumni are encouraged to submit any questions they have via the chat feature of their Zoom sessions. I will synthesize these questions and ask them on your behalf during the last 10 minutes or so of the lecture. And with that, welcome Team Panorama. We are super excited to hear from you guys.
Hi, Jack. Thanks for that introduction. And hello, everyone. We are excited to be here. I'm going to kick us off and then bring in my colleagues throughout the next hour. Before we dive in case you did not pick up on this already from our bios, I want to get the elephant, kind of identify the elephant in the room, be blunt, and get something out of the way from the beginning, which is we are not researchers and we are not academics. And I know that there can be this infamous divide between the academics and the program people. I know the academics look at us and say, gosh, like they're a bunch of liars. And because we do, we misrepresent your data all the time. We don't do it on purpose, but we're so focused on what's the so what, what's the spicy, sexy takeaway, what's the, the Twitter, the 160 character way to boil down a lot of research. So we do it, it's not intentional, but I know we're working on it. Likewise, we look at academics and we think, gosh, their PowerPoints are so ugly. And for some reason, like we think that's important and care about that. So I know this tension exists, but if you're willing to put it aside for the next hour, so are we, because the reality is I know that we need each other. You all are out there identifying problems, identifying root causes, coming up with solutions, assessing what's working, assessing what's not working. And then we take all of that and put it in beautiful PowerPoints. So really the role, we're working together and hopefully you'll see that we aim to do a little more than that, which we will talk about today, the work that we're doing in advocacy and policy change in helping enable implementation of new programs and ideas that originate from data science and research. So today we're going to share a little bit about Panorama Group and our organization, and then we are going to highlight a couple specific examples of projects that we do and our reflections on data science and what it means for our work. So I will kick us off with an overview on Panorama Group. Panorama Group, we are a platform for social change. And what does that mean? It means essentially we don't specialize in one specific topic area or functional area, but rather we specialize in making change happen, doing whatever it takes. The idea being that true social change often comes by working together, working across entities, across sectors, across topic areas. And no one organization or functional area can do it alone. So what we do at Panorama is to mobilize change makers to work together, and we aim to equip social movements with the tools needed to drive impact. So as Jack mentioned, we have 3 different organizations within the Panorama family: Panorama Global, which is a social impact nonprofit; Panorama Strategy, a social purpose consultancy, which is where I sit; and then we have a new entity, Panorama Action, which is able to lobby in pursuit of social impact goals. This next slide shows a sampling of the many different things that we do and the different hats that we wear within Panorama. So we provide behind the scenes operational support for emerging nonprofits. We run collaborative funds where multiple donors can pool resources to support a social cause that they care about. We deploy funds to grantees. We've launched coalitions. We've served as secretariats. We provide consulting services, and the list can go on. And through that, we've worked on a variety of projects in different topic areas. Our work spans both domestic work and global work. The topics we tackle range from public health, gender equity, climate justice, adolescent mental health, and more. And working across all these areas allows us to take learnings from one issue area and apply them elsewhere. It also gives us exposure and experience partnering with a range of partners ranging from academics, philanthropists, NGOs, governments, etc. And through all that, we've learned a lot about what it takes to achieve change. So for the next bit, we're gonna kind of deep dive and share more about 2 of our programs. One is the Pandemic Action Network. We'll hear from Autumn and Darcy, and then Jen will talk to us about the COVID-19 Action Fund for Africa. And then I'll come back and share some reflections on what we've learned from our consulting work. So with that, Autumn, over to you.
Thanks so much, Julia. Hi, everyone. It's my pleasure to provide a little bit of context and introduction on what Pandemic Action Network is and what we do, and how we translate data, insights, research into actual action and progress when it comes to pandemic prevention, preparedness, and response. So I'm going to give a little bit of context and turn it over to my colleague, Darcy, and then wrap it up with a little bit before we turn it over to Jen. Next slide, please. So what is Pandemic Action Network and what is our role? Essentially, early in COVID, the DNA for Pandemic Action Network started far before that. But a group came together understanding, based on experience from previous outbreaks, namely Ebola in West Africa in 2014 and 2015, that in order to actually create change, in order to accelerate the response to COVID, and to ensure that the lessons from the COVID-19 pandemic actually translate into real change and better preparedness and improvement in the future, that we needed advocacy in the mix. So Pandemic Action Network really came together and coalesced around an advocacy network to bring advocates into this space to translate recommendations, reports, research into tangible action. Because what often happens in a pandemic is there's a moment of crisis and there's a lot of action around the crisis. And then, as we're seeing right now, people and leaders collectively move on. And there will be a lot of research on the table, a lot of reports, a lot of landscape analyses pointing to next time we should do this differently or lessons learned. But there is a difference between lessons documented and lessons learned. And so Pandemic Action Network's role is to really be that connective tissue and translate the recommendations into real action. Next slide. Oh, it looks like, there we go. So just to put a finer point on it, our mission as a network is to drive collective action to end the COVID crisis for everyone around the world and ensure that the world is better prepared to respond to outbreaks when and where they happen and to prevent the next pandemic. And the way that we do that, our theory of change essentially is that we need a lot of different folks in the tent in order to tackle these enormous challenges. So we believe that if we have a diversity of stakeholders working together, that we can create advocacy pressure to compel political leaders and policymakers to act. That means that the network is incredibly diverse. We are not just a network of NGOs or a network of philanthropists, funders, or private sector, or academia and research, but we bring all of those powers and perspectives to bear and do that at a global level, at regional levels, and at national levels. Next slide, please. So with that, our approach is really a partner approach. We're actually a pretty small and mighty team that has grown up since we started this work in April of 2020. We started out with about 25 partners around the world. We've now grown to over 350 partners across sectors and across regions who are actively participating and lending the strength of their organizational leadership, their voice, their strategy to this fight to ensure that we're better equipped at every level to prevent a crisis like COVID from happening again, but also ensuring that we're better prepared in the future when outbreaks do occur. And then all of that is powered by our tiny but mighty team, which is also spread out across the globe. We now have 18 people in 9 different countries in order to power this network. Next slide. This just gives you an idea of the vast diversity of our network. This, by all means, is not all of our 350 partners. It would become just illegible at that point, but we're starting to get there even with jamming all of these logos on a single slide. But you can see the diversity of those who make up the network, from the private sector, businesses like 3M, Johnson & Johnson. We also have significant public health agencies such as the Africa CDC, that are actively involved, NGOs and advocates at virtually every level that are a part of the network day to day. Next slide. And the way that we come together are through various levers of action. So we are essentially a policy and advocacy network, but in order to really drive pointed policy change when it comes to, you may have heard in the news this week, talking about the pandemic accord, or there's a number of international health regulations that are up for review and reform, or issues related to vaccine equity. In order to do that, we really have to drive coalition building and convenings around specific moments. We also have to actively engage influencers and key opinion leaders in order to put pressure on political leaders to act. And all of that is supported by very strategic communications and at key moments, campaigns in order to ensure that these priorities continue to stay at the top of the agenda. This is increasingly more difficult in the current context. Next slide. So overall, our strategic program of work at this point in time, it's really evolved. But in the beginning, of course, we were focused on emergency response to COVID and what was necessary from that perspective. We have since evolved our approach as we're really looking at pandemic prevention and preparedness and focus more on ecosystem reforms, on ensuring that there's money for all of the things that need to happen to strengthen health systems, that proper governance and accountability is in place. And all of this is supported by a network model. We want to ensure moving forward that we don't have this huge gap in advocacy when it comes to these critically important issues, but that there's capacity building and that is sustained over time. Next slide. So just a little bit of context as we continue the conversation today in terms of like where we're at on the map. And I've alluded to some of this already, but we're in a very different place than we were 3 years ago. We're now entering year 4 of this pandemic. We just marked the 3rd anniversary of the declaration by WHO of COVID as a global health emergency, so public health emergency of international concern. At that time, all of our focus was on the pandemic. The whole world was watching. That's no longer the case. We're in this moment of what we're calling polycrisis, where there are so many different crises that are on the map, from Ukraine to energy crisis, debt crisis, food crisis. It is very distracting for political leaders, and yet all of these things are connected and compounded by the persistent pandemic. There's also a real lack of coordinated and dedicated global leadership to these issues. Pandemics have really fallen down on the agenda, and our role is to ensure that does not happen. And we're really a force to counter this cycle of pandemic fatigue and cycle of neglect that really persists in this space, because the work is not done yet. And if we're not in the mix and not being relentless about it, there is really a gap. Because we know that health systems are stretched at basically, we're at a breaking point around the world. So many things have fallen by the wayside because of the focus on COVID and the pandemic. There are staffing shortages, there's a decrease in routine immunization globally, and there's the need to address those issues while at the same time ensuring that we're addressing the persistent pandemic. As we also look forward in terms of communications and the context around all of this, we're seeing the real increase in anti-science and disinformation rhetoric, a lot of distrust of public health authorities. Specifically in the United States, we're really seeing a risk of disinvestment in this area precisely when we need to reinvest. So all of this is to say is that the challenges are great, and the work of this network is incredibly important and needs to continue. Next slide. All right, with that, I'm going to turn it over to Darcy.
Great. Thank you so much, Autumn. Hi, everybody. I'm Darcy from Evoke Kind, which partnered with Panorama back in March of 2020 to co-found the Pandemic Action Network and have the great honor of staying on as a communications partner and as leadership on the Behavior Change Communications Work Group. So I get the privilege of talking to you about the work group, but also how we actually use and talk about data science in this group. So go ahead on over to the next slide. When the crisis hit, when the pandemic hit, we really wanted to pull together folks to talk about what we could do now to help influence the behaviors that needed to change to prevent the spread of COVID. So we brought these folks together into a work group. Our mission was really around a specific behavior. We chose masking as the behavior that we could really drive consensus and leadership on. But what that practice gave us was the structure of a monthly meeting of bringing these disparate groups together, as Autumn had said, across like academia, media, communications, NGOs, public health, et cetera, and be a force, a collaborative force to make decisions, to share information, to share learnings, to set an agenda of what needed to be done and figure out, is somebody covering it and can we help that person? And now we are in this wonderful, almost sort of routine of getting back together every month and having about 1 to 3 experts, either from within the work group or invited guests, to come share what they're working on, what their research is. And some of these, the presentations that stick with me the most are the ones that are really rooted in that data science and that are data-driven solutions for disease prevention. So I'm going to share just a couple of those presentations with you now, but really an open invitation to come learn more about what Pandemic Action Network is doing specifically in the Behavior Change Communications Work Group. All right, so over to the next one. So one of our partners that came and gave us a presentation early on actually came with an idea, not a finished product. And the idea was, within the United States, we were starting already to see these partisan divides around vaccination intention. And how could we actually understand more about what's going on in that space and then use the best of data to inform a solution? So even though under the Trump administration was the development of the vaccine, there was also sort of in equal measures distrust, hesitancy that was often identity-based. And so we helped a coalition of academics develop actual messaging and materials for an ad that was aired through a purchase on YouTube in specific pro-Trump counties that put the vaccine in the best possible light. And they did a large-scale randomized controlled trial with it to assess whether this counter-stereotypical messaging and partisan cues could actually induce vaccination. And what they learned and saw in those results was, indeed, the counties that were served up this particular ad showed higher vaccination rates versus matching counties that did not show the ad. So I know you're all saying, okay, that's great. I love seeing numbers, but I love seeing ads even more. So Julia, if technology will comply, is this a part where you can switch over to the ad itself? And don't forget to share sound.
Donald Trump is urging all Americans to receive the COVID-19 vaccine.
I would recommend it, and I would recommend it to a lot of people that don't want to get it, and a lot of those people voted for me, frankly.
Both Trump and former First Lady Melania Trump did receive their vaccines privately in January at the White House.
Thank you. Yeah. I just love to share that example because we followed the full arc of that progress, right? There was the data to show the need that we all responded to. We helped identify where some of the potential spokespeople could be, what were some of the messages that were seeming to work with this audience. And in fact, it was another presentation from our work group that had that data about that line, your vaccine is waiting for you, that had come from previous flu research that showed impact that they were able to use as the call to action at the end. And then of course, they had the data to verify and validate the results of the whole entire project. So you'll see the reference at the bottom if you want to look at the publication. So that was just one example. Moving now across the Atlantic Ocean, we were able also to hear from the UK government on their approach and also how they use data as a platform to absolutely track every step of the way where response was happening to various stimuli in terms of messaging, access to COVID prevention measures, whether it be masking, later on vaccination, stay at home, et cetera. And they went through bit by bit with our work group to go through all the dashboards that they had established, and also how they use the mechanisms within the UK government to be able to quickly respond to any sort of miscommunication, misinformation that was out there, and ensure that different stakeholders within the community were serving as key messengers. And through the measurements that they had, they were able to actually track how many people stayed at home. You'll see in the data here, almost 5.9 million, 3.6 per million social distance as a direct result of their communications. And then they were able to model how many infections were prevented. And what I think is stunning, that they were able, with a certain amount of confidence, say that through these particular strategies, between 22 and 27,000 lives were saved, which is stunning. Now, this is not a setting where Pandemic Action Network did this work, but through that collaborative and networked approach, a much wider range of NGOs, nonprofits, other governments had opportunity to learn from this and be in touch with these so that they were able to follow along and make sure they had that benefit of that learning. So my final example is a little bit about past and future. So we've been partnering with the Mercury Project, which is a call for basically research and projects globally to actually use data to understand and to come up with data-driven solutions to improve acceptance of vaccination and to dispel misinformation and disinformation about vaccination. So they have come and presented to us a number of times, including when they were doing their first call for a cohort for when they were funding. And through Pandemic Action Network and other partners, we're able to find projects all over the globe that are actually tackling this issue, who are currently in the field right now. So at our very next meeting, which is on February 16th, we're going to learn from the Mercury Project how that first cohort is going. They're going to present a new framework for research that they are using across these projects. And they are also going to announce, and this is what I really wanted to stress for this group, a new call for proposals for the next cohort of projects. So as you are going through this program and thinking, how can I get involved? What would be connected to this? If you have an intervention designed to increase demand for vaccinations consistent with national priorities, and that could be not just COVID vaccination, but childhood, HPV, polio, measles, et cetera, this could be an opportunity for additional funding. So you'll see the link there for how to get more information about that. So without further ado, I'm going to turn it back over to Autumn to tell us what's next for Pandemic Action Network.
Thanks, Darcy. Well, what's next for Pandemic Action Network is a much bigger conversation. But one of the things that we wanted to leave you with is a little bit of a forward-looking, just thought starter in terms of potential areas for research and inquiry. And as we look at addressing secondary side effects of COVID-19, look, there are many. There are public health, social, economic, political challenges related to long COVID, mental health, education, deferred healthcare, the real failure of political leaders to act or disinvest precisely when we need to invest. As I was speaking about earlier, the growing attitude of anti-science or dismissiveness. There are actually so many secondary effects of COVID that we actually don't even know yet. However, we wanted to leave you with two thought starters. First is a trend that we're seeing in terms of growing distrust in immunizations. And this is not limited to COVID. Although COVID-19 anti-vax attitudes increasing has potentially impacted what we're seeing across the board. There was a recent study by the Kaiser Family Foundation. You can see some of the headlines on the right here in terms of growing vaccine hesitancy, fueling measles, chickenpox resurgence in the US, opposition to school vaccine mandates. From that recent study, it was determined and it was clear that more than a third of parents now say that they should have the right to not vaccinate their children for measles, mumps, and rubella. This is an issue based on recent data that is also clearly partisan in terms of 44% of adults who either identify as Republican or Republican leaning, saying that they should have the opportunity and the choice to opt out. This is a jump up from 20% in a pre-pandemic poll. This is very significant and has the potential to really have an impact on public health and health systems in the United States. So that's one area to get you all thinking. Another area is more squarely in our wheelhouse. And if there are areas of inquiry around this area, we really want to talk to you. And this is around the failure to act on the impact of the pandemic. We know that the COVID-19 pandemic has basically affected us all in one way or another. Some more than others, of course, but it is in the double digits in terms of those who have been personally impacted by losing a loved one. Like we feel these impacts quite personally, and yet the rhetoric at the political level is disconnected from that reality. And in recent polls from national polls in advance of the last election, the midterm elections, it actually showed that like COVID-19 was like the least priority for people. And yet the priorities politically were around the economy and inflation, all things that are actually squarely tied to the pandemic. And so we have this disconnect between individual and personal experience and constituencies and political leadership and areas of investment. In a recent report from the International Federation of the Red Cross and Red Crescent Societies, they defined the pandemic as the biggest disaster in living memory, more than any earthquake, drought, hurricane in history has claimed as many lives. So we're at a time where we really need political leaders to act with urgency in response to this crisis, but we're not seeing that. And what will it take to actually move a shift in narrative and a shift in action? And just as a corollary, when 9/11 happened in the United States, there was a commission in Congress and actual clear actions and policy changes. We're not seeing the same level of action. And on the contrary, a lot of politicization, and that's specifically in the US, but we're seeing those trends across the board. So 2 areas to consider for future inquiry. With that, I'll pass it over to my colleague, Jennifer.
Thanks so much, Autumn. So as I start, I want to mention briefly that just prior to joining Panorama, I was in university development for 10 years. And over that period of time, had the privilege of supporting engineers, data scientists, and public health professionals. So I have a deep appreciation for this lab and the work that you all do. I'm so thrilled to be able to be here. Starting in 2022, I had the privilege of working on 2 major COVID-19 response projects, a grant-making initiative, fund in support of mental health and well-being of BIPOC and LGBTQ+ adolescents. And this project that I'm about to share with you, where we got to go deep on global health challenges under the aegis of Pandemic Action Network. So as you may be able to guess from this quote, I am about to ask you to come back with me to March 2020. What was starting to happen then? There was a global scramble for PPE among even the world's wealthiest countries. We discovered that most of the PPE was being manufactured in just a small number of areas. Shipping had slowed down. And here in the US and around the world, routine healthcare had paused. Next slide, please. So for those of you who are not familiar, community health workers are sometimes called the invisible cadre, but they are the first line of defense of prevention and treatment for hundreds of millions of people around the world, including here in the US. So as the pandemic is starting to happen, what do we know? In most countries, that are heavily reliant on community health workers as part of their health systems, they are not formally part of the health system. So they are not counted as part of health worker counts, meaning that we are not including them in projections for PPE need. I think the thing that we all know very deeply right now is that frontline health workers need PPE to work, both for their own safety and so that they are prevented from becoming vectors of disease infection themselves. So this was flagged early on by the community of organizations that support community health work. The first recorded death from COVID-19 in Sierra Leone was a community health worker, the longest tenured community health worker in the country. And then this critical piece of information that is the last statement on the slide. Sometimes during times of crisis, it's the stoppage of essential health services that actually leads to more death. So all the more reason for attention. Next slide, please. For those of us who work in global health, there was an obvious solution. Someone needed to ensure that community health workers had PPE, and we were going to need to use private funding to make it happen. And there was going to need to be a mechanism to make it happen. So next slide. So this Life or Death Challenge brought together more than 20 non-governmental organizations and 18 ministries of health with 5 lead organizations. And Julia, if you'll click, please. Here is where I betray my age. For those of you who might remember Voltron or the Thundercats or the Power Rangers, you'll get the idea. A group of organizations, a number of which collaborate regularly and several of which are already members of Pandemic Action Network, formed an ad hoc group to take on key pieces of work in a radically collaborative way to figure out to solve this problem. It helped that several of us, as I mentioned, were collaborating already. And really what informed this is that we've been working very long-term in spaces of advocacy to understand how does the health system work, what are the challenges, and who needs to be engaged in this effort if we have to create our own mechanism. So next slide. What did we do? We created an end-to-end mechanism to make this happen, from needs estimation, fundraising, sourcing, all the way down to last mile. And why did we think this would work? We had longstanding relationships with donors who support community health workers in disaster relief. There's our private funding. We had the ability to move relatively quickly thanks to relationships with organizations and ministries of health. We had been doing ongoing work to ensure that the emergency effort could potentially influence global health financing mechanisms. And we were going to take a pooled procurement approach, which meant that this collection of otherwise of low and middle income countries who otherwise would have no way of competing in the global marketplace with countries like the US could become competitive because they were sourcing across countries. So next. I'm going to start here by highlighting a few different elements. And I'm very aware that as we think about this is small data, but it is small data that sits on top of really big data, as you can imagine, but in ways that is messy and spread out over countries. So if you think back to what I said earlier, what do you do when there isn't a formal count of community health workers? Well, you go to the organizations that support community health workers and you source the information that way. So we worked with 20 plus organizations to pool the information that they had to create a count. And that count then enabled us to have a marker against which we could apply the best information we had available in April 2020 to project what the actual need would be in terms of supply. And then if you go to the next slide, what it was going to cost to supply community health workers for a year. I want to pause here and say $100 million is a lot of money. And yet when you think about $100 million in terms of 400 million people who rely on these services, it's not very much. And at the same time, we also knew that in trying to do a rapid response, it wasn't very likely that we were going to be able to raise $100 million, but we were ambitious. And it was part of an effort to message that in the grand scheme of global financing, it wasn't a lot of money to be able to protect the health workers who are serving 400 million people. If you go to the next slide, please, this is where it gets interesting. We had 4 elements in this process that were constantly in flux. Imagine the sliders on these bars moving day by day. The best analogy that I had to explain this when I was talking to donors, it's like using GPS. If you're the kind of person who's willing to take the recommended side route, it's in constant calculation all the time. So if somebody would tell me on a given day, I need you to be able to tell me how far is my $2 million going to go? I would have to say, well, it depends on what supply we have and the shipping and the ability of these countries to accept the funding or accept the supply. We were constantly calculating to maximize donor dollars, speed, and assure quality. So from here, I want to highlight a few things on the next slide. From left to right, it's very hard to see this, but we got very lucky that we were under the leadership for this component of direct relief, which is one of the country's largest humanitarian relief organizations. They had great relationships. So on behalf of the countries we were working with, they were able to negotiate an incredibly good rate at a time when the market was at peak to enable us to supply countries in sub-Saharan Africa. They were also managing all of that list of items in the early stages of this. We had to make sure the supply in a very rapidly changing environment would be able to meet our own quality assurance as well as the requirements of individual countries. If you look at the middle section, again, remember that shipping had slowed down. So for the first 1.5 rounds of procurement, we benefited from the fact that the World Food Program, working with some donors, had set it up a free-to-use or transport. And because we were working at such a large scale, we were able to leverage free flights for quite a bit of this work, meaning that our donor dollars were going more towards supplies. And then in that third photo, even as you think about even as we were procuring, we were needing to think about whether countries were even going to be able to accept the supply. So memorandums of understanding needed to be in place with each country. And for some countries, they hadn't ever had to manage supply at this scale. They didn't always have the technical capacity or experience to handle it. So we had to do some training. In Uganda, for example, this was the largest shipment of supplies they had ever received. And we had to break it up into 2 pieces in order to enable them to do it. And then just moving quickly to the next slide. How are we ensuring these get to community health workers? If you've worked in global health, you know that sometimes this is the hardest, the last mile. I've highlighted 2 of the more extreme examples of ways that we got supplies to community health workers. On the left-hand side, these visors went to a polio campaign in the Democratic Republic of Congo that we weren't sure was going to happen, but did because the supplies were provided. 8,500 community health workers went door to door to ensure the campaign happened. And in the next slide, you'll see we did some pretty intensive tracking. Where possible, we used the Ministry of Health supply chains to do this, but otherwise we were relying on NGO expertise to get this done. In the next slide, our impact. So we started our deliveries in August 2020. And by January of 2022, this is what we had achieved. I want to highlight, this was shocking to us. In 2020, we were the 5th largest procurement mechanism for PPE. But the most important thing was, Julia, if you'll click again, this was the impact. We were able to achieve as much as possible to prevent a stoppage in routine health services at the community level. So what did we learn? There's some highlights here. And one of the things that that was very exciting for us is this last point, where in some instances, we were able to use this as a leverage moment to finally get community health workers recognized as part of the health system. Most critically for us, in the middle and end stages of this, the last thing that we did as part of this project when we wrapped up in January was that we took all of the lessons learned forward through Pandemic Action Network to provide information to the global health community about gaps that we were anticipating that would prevent things from moving forward, improvements that could be made, and key areas that needed to be addressed. We're hoping that this effort, in addition to having a tremendous impact on delivery of health services, will also serve to continue to reinforce the need for pandemic preparedness and the inclusion of community health workers. I'll stop here. There's a variety of different information that we provided in the slides that were shared with you earlier, and we would be happy to answer any questions.
Great. Thanks, Jen, and to the whole team. I'm going to spend just 5 minutes wrapping us up, and then we will do some Q&A. So as I mentioned at the beginning, I work at Panorama Strategy, which is the consulting arm of the company. We realized that from all these different programs that we've been involved in, we've learned a lot, and we now want to support other people who are engaging in social change ambitions to share our learnings and help them enhance their social impact. So I'll share a little bit about us and then some of our learnings in terms of data science. So our focus is on, we help clients with strategy development, strategic communication, stakeholder engagement, and advocacy. We partner with a number of different types of organizations, from philanthropy to academic institutions, multilaterals, government agencies. We partner with pharmaceutical companies and others. Basically, we are willing to engage with anyone who has the goal of having social impact. And then what we've learned through that work is, the world has changed so much since COVID, and things that we thought we used to know about global health, about other areas, we no longer know. We need new data. We need to understand the secondary effects of COVID-19 and how it has touched every other element of our world. Most importantly, what we've learned is that the pathway from evidence to public health impact is rarely straightforward. Ideally, we would, once we have the data to understand what is the problem, what are the solutions, like that would be it. However, in reality, that's typically only step one. Instead, what we've found is we are constantly relying on a number of different levers and going back and forth between them in order to reach that impact. So for example, we're helping our partners figure out what advocacy is needed. What are the different platforms to disseminate your message and the advocacy material? And what is the framing and the strategic messaging that will resonate with key decision makers? We're looking at, what is the state of the world right now? What are the topics people care about? What will help politicians get reelected? Understanding different people's interests and priorities, and then helping to tell a story in that context. We also realize that often what's required is policy change, and we look across global, regional, national, local policies. Informal recommendations from trusted advisors plays a big role as well. For example, in my previous work, I spent a number of years in Africa and Asia supporting governments on new vaccine introductions. And we found that when we did field research, a number of countries had a rule that if they're going to make a policy change, they need one of their government approved people on the research team who's doing the field research. So understanding, what does it take for decision makers to act on the evidence that they have? Also, in terms of changes needed and solutions to problems, it's often much bigger than the one thing that you're trying to change, but there's a surrounding ecosystem and infrastructure needed to enable that change. So for example, sustainable financing, changes in global health often has impact on the health workforce and the HR needs. There's supply chain factors to take into account, as Jen spoke to. Sometimes systems need to be reconfigured. Behavior change, as Darcy spoke to. These things are all relevant to almost every issue that we're tackling. Likewise, for change to happen, as we talked about at the beginning, there's a role for a lot of different stakeholders to play. So there needs to be strong coordination to move the group forward towards shared goals. There also needs to be strong leadership in social movements. And then not just funding for the implementation piece, but funding for all this other work. There needs to be funding to, prop up the advocacy movement, or to take the time to do the necessary steps to go through policy change, to fund the research, to have the answers. And we spend a lot of time playing between these webs and bouncing back and forth and making progress and then having to shift in another direction. And I am really excited to be joining those of you who are going to the Innovation Lab in June. I'm really excited that I'll be spending that week with you and be helping to think through for the different research projects you're interested in, what is the surrounding policy context? What does the advocacy space look like? What are non-traditional research outlets, research funding outlets to consider? So excited to spend that time with you all. For now, a few just closing kind of high level thoughts. I think a few key takeaways. So I think one is when designing and conducting research, I hope it's, you see it's important to know what does come next and what are all the contextual factors at play, and knowing that early can help in the design and planning around research. I also think it's important to strengthen the collaboration and communication across that academic program divide. I think there's a lot more that we could, advance, and I think we could work with a lot of efficiency if we were in better touch across those communities. So those are a couple of reflections from us. Really enjoyed getting to spend this time with you. And for now, we'll turn it back to Jack, who will field any questions.
Oh, thank you so much, Julia. Thank you, Jennifer, Darcy, and Autumn. This was really a fantastic presentation from the Panorama team, and you guys have done so much stuff. One of the things which I think was just dawning on me as you guys were speaking, and it was kind of when Autumn was presenting some of her comments about, really we witnessed something with the pandemic that I don't think we've probably not seen in my generation up until then, and certainly many of us have experienced the same thing, was science in real time. Right? Science was happening, and it was in this really compressed time frame. And so, pity poor Anthony Fauci, kind of taking it on the chin for us all as we watch this process go on, where people didn't really realize what science kind of involves, which is a lot of wrong turns, a lot of, getting new information, incorporating it and changing it. And you talked about the loss of public trust. And I was kind of curious about how nimble are organizations like yours to be able to help smooth that process so that people can take action, but at the same time realize that stuff's happening, changing every day. How can your organizations help with that to educate people and policymakers about those things? Autumn, maybe you can comment on that.
Yeah, I'll start, and then I suspect that Darcy has some thoughts as well. Yeah. As a network, we work through our partners. And so there are different ways that we've activated, particularly around clarifying message and responding to mis and disinformation, because it is all around, and it has just felt exponential. And so through our partners, we've been able to leverage resources when it comes to key messaging around, XYZ and setting the facts straight, which has been incredibly important for the general population audience, particularly early on in the pandemic, because public health communications is quite challenging. Again, Darcy can do a TED Talk on this in her sleep. But there's so many things that we don't know. And when information changes and when the information evolves, there's a lot of lack of understanding of well, last week you said this and now you're saying this. And as a network, it was really important to leverage from across our network the best information and resources and messaging so that we collectively could all be on the same page. And that's important. As things have continued, and now that we're squarely on the backside of the vaccine era of the pandemic, there's a whole other set of mis and disinformation. And there's the tip of the spear, but there's the back of the spear in terms of responding to that. The tip of the spear is really where people receive their information. But from an advocacy perspective, our network has worked with partners such as the Center for Countering Digital Hate, which is based in the UK, but works globally to really advocate to platforms themselves in terms of how they provide a space for mis and disinformation to spread. And we saw it very early on in COVID, where you were seeing all sorts of things. And then there was a tampering down and a very intentionality of not giving the green light to any conspiracy theory and rumor. We're actually seeing a dangerous backsliding on that now with recent changes and ownership of different platforms and whatnot. And it puts the onus even more on the platforms and on our community to continue to advocate, to protect folks and really ensure that the facts are surfacing in the media. We also have organizations that are part of our network that are actually actively focused on using the latest data and insights and guidance to educate the media themselves and journalists, because all of a sudden you had every journalist in the world became a public health reporter and they never ever covered public health. And that's quite a challenge. And so there's a media literacy piece of all of this. I'll stop there and turn it over to Darcy.
Yeah, I just want to say with science and then the communication of science and health messages, it really is a strength in numbers situation. And one of the benefits, I think, that a role that Pandemic Action Network could play early on and continuing on is making sure that all of the key players who are both in the space of learning, but then also communicating out, we're talking to each other. I mean, I saw it through multiple phases in the masking messaging of how we were getting out, because obviously the science that we had in terms of the benefits of masks as prevention from COVID spread is a question that was constantly evolving. And what kind of mask, what level of protection? Does it just protect, if you're the person who's sick, does it protect the people around you? Or do you get some measure of you're the healthy person of protection? These were questions that did not have good answers for a long time. But what we were able to do, frankly, is through our various partners, make sure we were asking those questions and getting the best answers that we had. And then the rest of the network was singing off the same sheet of paper. And then as there was new information, that we were also prompting folks across the network for new information. And as we were preparing for, we launched World Mask Week in the summer of 2020 to really get these partners on board to be all singing in concert on this message. And I honestly remember some conversations with various folks at CDC and other places where it was evident that even among our network, not everybody had sort of the latest and greatest. And so to make sure that everybody was having what is the best science at that moment to be able to sing off of that sheet of paper. And that's particularly as things like better masks came on the market that were more readily available, that they were less worrying about not being available for healthcare providers. We were able to act quickly on that. But I do believe that the next, we need to make clear sort of from the outset about science education, health education, that change will happen so that we can prepare folks for it, that we will always give the best of what we know now, and that will be evolved, and then they need to come along with us for that journey.
Fantastic. Jennifer, you had really gave a fantastic example of just a logistical challenge of trying to figure out how to get money for something, how to then go and scale it appropriately and then deliver. I mean, the logistical challenges were really evident there. And anytime somebody does a Power Rangers name drop, I'd you got my attention. I wanted to ask you, what role could data scientists help play in helping to make sure that the mathematics that went behind the distribution and the logistics of all that, how could that be brought to bear to help streamline and make that process more efficient?
So here, I'm going to apologize in advance if I accidentally offend anyone. And this comes from having had the privilege of working with some data scientists. I think there's a few things. One, when you work at scale with data, you have, at least as I understand it, there's some wonderful opportunity in there for you to see patterns that are not evident to those of us who are working at it day by day, who are inputting just a small set of those. And so there's a little bit of a superpower in there and helping us understand that you can see something coming, or you see something that is, if we zoom back out from it, what is the opportunity there? We're trying to fix small things in big systems that are complicated. Is there a bigger fix that could happen because of that? I think the other thing is that I have worked with people who are both very excited to, or also very opposed to the idea that the kinds of tools that are needed in the moment when you're trying to be nimble, when you're working with smaller sets of data, when the data is really messy. Sometimes what we call at the field level, a tool is so rudimentary to people who are thinking about really complex data. And, but you also have no idea how huge an impact a small tool that is easy for you to build can have. I think I'm just going to admit that we were managing all of this information. When I showed you those slider bars, that was a series of Excel spreadsheets. It maybe didn't need to be more complicated than that. But when we think about planning as that scales, and we think about how those tools translate back to a community, what could be built that is simple to use, that accommodates the data and has the ability to scale. So if anytime you look at something and you're like, oh, that's so easy, maybe think about I can take a few minutes and create that, and then maybe to learn something from the data that's going into it.
That's fantastic. I think we're very close to the end of our time here. I wanted to certainly thank Julia for organizing everybody, and thank Autumn and Darcy and Jennifer for providing kind of examples of things that are going on with the team here, and the various things that Panorama Group has going on both in the US and around the world to really help us get our thoughts together to build the network we need to be able to know who we can talk to help make sure that people are getting the right information to be able to affect policy, to affect change, both policy-wise and behavioral. I was very excited to hear about the Mercury project as well. And so I look forward to kind of poking around in there a little bit as well. But thank you for bringing that to our attention. And thank you guys for sharing this with us. This is really wonderful work. And I'm sure that everybody is from our participants are going to be very excited to talk to Julia here in June in person to find out more details. So thank you again. And thanks to everyone who joined us and who's watching on